Myself, Dr. Salman, and as you can see, we are going to start with the recall session of microbiology for the FMG exam that just happened yesterday. So without any further ado, let's begin. But before I start this session, please understand that it's a recall session and definitely there will be change in the language of the questions. But the whole idea is to get which topic was tested and, roughly speaking, in what manner. And this is definitely going to help the upcoming batches. So whatever the questions I'm discussing here, if you feel you remember the correct one, either the question or the options that were asked in that, please feel free to discuss them in the comments. So here's the first question. A patient presented with a nail involvement, image of which is shown below. Identify the agent. Guys, this image is something like you got to know before you enter the exam hall. All right. So they're talking about dermatophytes, as you can see. And the thing to remember is there are three types of dermatophytes, as you know, as you can see here: trichophyton, epidermophyton, and microsporum. Now, whoever might have attended my classes, etc., you know that there is a mnemonic called epic trip that I usually teach for this. And this question is straightforward from that. So this one, the answer is none other than your epidermophyton. Okay. Why would the answer be that? Epidermophyton has club-shaped macroconidae. And how do we know this? Epic. And then you got to know what is trip. Trichophyton would have had pencil shaped. All right. So trip, this is the word. Epic trip, you got to remember. So anyway, as I'm telling you, the answer is epidermophyton right here. This is a very classical image that usually will be tested in the examination. So the next question here, once again, something from the expected type of questions. What is the mechanism of action of the diphtheria toxin? See, from the general, this is one thing that they love to ask, like, the mechanism of action of toxins. Diphtheria toxin and one more guy called Pseudomonas toxin. All right. These are the two toxins that will inhibit protein synthesis. And how exactly do they inhibit protein synthesis? What is their mechanism? Let's have a look. See, actually speaking, there are 4 organisms that inhibit protein synthesis. Okay. So what are these guys and how do they do that? There are 2 mechanisms. One of them is they block something called elongation factor. Elongation factor, you can think of it like this. A protein is made up of polypeptide chain and we need to elongate that polypeptide chain, and this factor, if you block, then the protein cannot be made. The polypeptide chain cannot be made. So EF2, you can see number 2 here, and you are going to remember two words, di and do. What is di and do? Di for diphtheria and Pseudomonas. So these are the 2 guys that inhibit the EF2. And next you have some of them that damage our ribosome, human ribosome, they're damaging. And guys, this is nothing but those guys that inhibit what we call as 60S ribosome inhibitors. Now, who are these guys who will inhibit this? Let's have a good look here. There are 2 guys who does this. One called Shiga toxin and second one called Shiga-like toxin. So you got to remember S for 60 like this, 60, S for Shiga, S for Shiga-like. So what did they ask us here? Diphtheria's mechanism, and this is quite easy. Diphtheria works by inhibiting the elongation factor 2. So this should be the correct answer. And likewise for the upcoming exams, you got to know what are the mechanisms for the remaining ones again. Next one. Identify the organism from the smear that is shown in the image below. All right. So you must know that this is a picture of Plasmodium falciparum. And how exactly do we know that this is falciparum? Guys, by looking at this things called banana shaped gametocytes. See, If you're seeing banana shape, that is falciparum, but if you see circular to oval type of gametocytes, then that might be vivax, the main two species that exist in India. All right, that's a very clean and distinct way to remember this. All right, and the way you have to remember this, I had given one mnemonic called BMAR. Falciparum is the one that makes us more sick because it causes more serious type of malaria. Example, cerebral malaria, it is caused by falciparum. All right, so anything serious is always by this. So it makes you more sick, that is, it makes you more BMAR. So what is the word BMAR here? B for banana shaped gametocytes. Next, something called Maurer dots, M for Maurer dots. A for acol forms, the ones that exist in the periphery of the RBC. They are also called applique forms. Next, falciparum affects all age RBC, young or old. And there is a thing called recrudescence that is seen with this guy that is called falciparum. So obviously I can't go into each and every detail right now. This is just a mnemonic by which you're supposed to remember all the features of this. So this was one question when it comes to this. So what is the correct answer? Definitely this has to be falciparum. All right. Next question, identify the organism from the smear that is shown in the image. So I was told there were two questions that came on just the identification of falciparum. If this happened, then that means that they have really helped us in the examination. They've given easier questions. So what is the answer here? Once again, the answer is falciparum only. And why is that? Because when you talk about falciparum, in each RBC, you can see multiple rings. You can see multiple rings. And you can see some of them, the applique forms or acol forms, that is kind of looking like headphones, towards the corners, etc. So multiple rings, and this, they kind of denotes that they're talking about falciparum. And here we go, the next question. See, once again, a question on falciparum only. Now we know that this is banana shaped gametocyte from falciparum. They asked what is the treatment of this. The treatment of falciparum is none other than what we call as ACT, artemisinin combination treatment. Artemisinin combination treatment. Now, what is this ACT that we need to follow in India? That also you got to know, sir. If you talk about northeastern states of India, there is a treatment that we give what we call as AL. What is AL? One of the artemisinin drugs that is called artemether along with lumefantrine. And if you talk about rest of India, then the treatment we are going to give, it is called ASP. Now what is ASP? Once again, an artemisinin drug like artesunate along with sulfadoxine and pyrimethamine. All right, so that is your ASP treatment. So technically they didn't ask all these details, but I'm letting you know for the upcoming exams, etc. You got to keep this in mind. Malaria is a very important disease of India. So they love to ask something related to micro or pharma when it comes to this topic. So technically, if you count, there were 3 questions just on the malaria topic. Next, a patient presented with diarrhea and the organism on microscopy shows darting motility. Which of the following is the culture media to grow the same? See, first of all, from this you got to remember darting motility. Diarrhea hua hai and followed by darting motility. Actually, the answer can be 2 things. One is Vibrio cholera. One guy who shows this is called Vibrio cholera. Another guy is called Campylobacter. Both of them show darting motility and both of them cause diarrhea. But how am I supposed to figure out whether they're asking Campylobacter or this? If you know the culture media again, right? The culture media that is given here, which happens to be the answer for one of them, it is TCBS agar. TCBS agar. So this is the correct answer. TCBS is the selective media for Vibrio cholera. Okay. If they wanted to give you that guy called Campylobacter, then they would have mentioned the culture media of Campylobacter. All right. Next, with Vibrio cholera, they may also ask the transport media in the coming exams. If you know, one of them has the Indian name, right? VR media, Venkat Rama Ramakrishnan, right? That is the name. VR stands for that. Or something called Kerry Blair media. So these are the transport media for cholera. Last FMG exam also, I believe there was a question on other Vibrios, which are called halophilic Vibrios. Halophilic means salt-loving Vibrios. They cause food poisoning. So that was a question, and this time something else on cholera they have asked. Okay. I'm not sure. I was told that there was a question on diphtheria. Some people were saying, sir, there were only toxin question on diphtheria. Some of them said they asked even some culture media on diphtheria. That's why I didn't put up the second question. If so, then it's an add-on question. If at all they ask diphtheria media, then I'll tell you two. The fast media for diphtheria is Loeffler serum slope, and the most selective media is called PTA, potassium tellurite agar. Okay, that would be the answers for diphtheria. If they ask best, you would answer PTA. If they ask fast, they would have answered LSS, Loeffler serum slope. Next questions, doctor. A patient who is HIV positive presented with a pulmonary infection. Bronchoalveolar lavage was performed and the image of this is given below. Identify the organism. Now guys, first of all, look at the hint. HIV is mentioned. Anytime they mention HIV, you should always open your eyes. And guys, HIV may have some infections that are very unique to HIV patients. Example, meningitis in HIV is caused by Cryptococcus, which is quite unique. And same way, the pneumonia in them is caused by pneumocystis. And Dr. Saab, this pneumocystis was previously known as Pneumocystis carinii pneumoniae, PCP बोलते थे इसको, Pneumocystis carinii pneumoniae. Now when somebody gets this infection, what happens is, when this organism enters your lungs, it induces inflammation and then plasma cells actually travel to that location. That's why it's sometimes called plasma cell pneumonia also. All right. So technically you see this two P's here and you got to remember something from this. Okay. This guy shows ping pong ball appearance. As a matter of fact, it's called as crushed ping pong ball. So ye PP you have to remember for ping pong. This pneumo you have to remember it causes pneumonia. And who does this cause in pneumonia? In HIV patients, especially when the CD4 count is around 200. All right. See, you know from HIV topic that you need to know HIV ke CD4 counts and which infections come at different CD4 counts. As a matter of fact, there was a question that was asked on the CD4 counts also, that is coming up shortly. So anyway, the correct answer is going to look like pneumocystis. Okay, so the next MCQ, as I told you, they have asked even something on the CD4 levels of this HIV infection, something called Kaposi sarcoma. So at what CD4 count do you expect this to happen? Please remember that this guy, the most appropriate answer is around 400. Okay, I don't know if exactly this option was given or something around this, but 400 is more or less the CD4 count that you got to remember at which Kaposi sarcoma is expected. TB is one of the most common infections happening in HIV patients, but that can happen at any CD4 count. It's not specific. It can happen at any time, although it is less than 500. Okay, 200 pe who do you see? 200 pe you see Cryptococcus, this guy called pneumocystis, etc., etc. Next, pretty much one thing they love from rickettsia topic, scrub typhus. Okay. I believe last FMG exam, they have asked or given a picture that somebody got a rickettsia presenting with a eschar. Eschar is a black necrotic area. Who is that? The answer is scrub typhus infection. Okay. Usually for rickettsia, the antibiotics given are doxycycline. This happened to be a question in another exam, right? And this time what did they do is the organism causing scrub typhus is what you can see in front of you, the one called Orientia tsutsugamushi. And guys, the vector that spreads this infection, it is trombiculid mite. Okay, it is trombiculid mite. This is the guy that spreads this infection. Okay, next, Ixodes tick is going to spread infections like Borrelia that causes Lyme's disease, and another infection that looks like malaria called Babesia. Next is Xenopsella chiopis. This is the guy that is causing plague. And last and the final, Culex mosquito. Culex mosquito spreads couple of infections, at least for Indian exam. You must know Japanese encephalitis and filariasis are spread by Culex mosquito. So either ways, the answer has to be trombiculid mite. Next question here is very straightforward, I would say. Primary lymphoid organ from the following list is. Okay. See, primary lymphoid organs are those organs where our lymphocytes mature. Look at the word lymphoid, that means lymphocytes will mature. There are two lymphocytes, B lymphocytes and T lymphocytes. Both of them, they are born in the bone marrow. Whether it's lymphocytes, B lymphocyte or T lymphocyte, they are born in the bone marrow. But then what happens is, for their maturation, they go somewhere else. Just like we are born somewhere, but for studies, we might go somewhere. It is like that. Okay. B cells will study in the bone marrow itself, whereas the T cells will mature in the thymus. Now, because these are the places where they're maturing, that's why they're called primary lymphoid organs. And that's what they asked. Now look from the list, which is the primary lymphoid organ. It is none other than your thymus doxa. Okay. And this is the reason why they're called B and the T cells. Doctors, there are 26 letters in the English alphabet, but they could have chosen anything they wanted. But why so random? Like one is B, one is T. The answer is right here. B for bone marrow, T for thymus. Did you understand this logic? And next, once they mature, they go and they start working in some places to fight the antigens. Those places are called secondary lymphoid organs, and the secondary lymphoid organs are spleen and the lymph nodes. Okay, liver doesn't happen to be a lymphoid organ directly. So basically, primary is bone marrow and thymus, secondary is spleen and the lymph nodes. Fine. Next is relative bradycardia is not seen in. See, this question, I'm not really sure whether they asked relative bradycardia is seen in or not seen in. And there were options that were given, sir, ye aaya tha. So, agar if they ask relative bradycardia is seen in, then this becomes a very difficult question, or in fact a controversial question. Why? Because it is seen in all these three things. Although in typhoid etc. we teach you most of the time, typhoid mein there is relative bradycardia. Kya bolte hain? What is relative bradycardia etc. See, look at the word relative. Relative means in comparison to somebody. All right. See, all the time if you were compared to someone in your life, who was that person? It's always your relatives' children. Yes or no? That guy's child is getting first rank. Why are you not getting? So comparison ko relative bolte hain. So you must understand something here. Usually a crude way that as a doctor we got to remember is, whenever there is 1 degree rise in temperature, there is roughly 10 heartbeats you can expect that will increase. It's a very crude way, right? 1 degree rise in temperature of body. What is going to happen? 10 heartbeats will increase. Pulse rate will increase. So here, compared to other fevers where 10 heartbeats are increasing, it is less. That's why it's called relative bradycardia. Okay. So this is actually seen in typhoid, and the others that I've marked. So in my opinion, agar question was is not seen in or except tha, then the answer should be Bordetella. Otherwise, it all depends what the examiner wanted to hear. Nobody, can say the answer to this if they ask relative bradycardia is seen in. Why? Because it is seen in other options also. Okay, so let's leave the controversial things out. I mean, there will be always some kind of questions like this that are controversial that may be asked. So these are the things that nobody can be sure of. So whatever we marked, just leave it. But if the question was this, then my option would have been Bordetella. Next is normal flora of conjunctiva is. Now, not a routine type of a question, but this is something like, as long as you know some basics, you could have applied your mind. See, conjunctiva, something more superficial, right? Skin is superficial. Who is present on our skin normally? It is a guy called epidermidis. That's why the name itself is epiderm. You know, in microbiology, we classify this guy in the category called cons. Cons like epidermidis are one of the most common organisms that you can expect in the eyes. Okay. Otherwise, apart from that, even on the skin, this guy is found. So that's it. The answer to this should be this only. This is something that you had to apply a bit of logic. All right. A 22-year-old male is brought to the hospital due to fever, frontal headache, photophobia, blah, blah, blah. Lumbar puncture was performed and, the CSF analysis shows cloudy CSF, polymorphs means neutrophils, low glucose, high protein. Sir, I would just look at these two things and I will figure out what that could be. See, think about it. I would always teach you this, that bacteria love glucose. So what happens is, because they love glucose, they will consume the glucose from the CSF. That's why the glucose will be less. In bacterial meningitis or pyogenic meningitis, what they call it as, there will be less glucose. The moment you see less glucose, now what you have to do is you should look at the inflammatory cell. If it's neutrophils or polymorphs mentioned, then your answer should be bacterial or pyogenic. But if they mentioned lymphocytes, then you should have chosen TB meningitis. TB mein lymphocytes are seen, but in pyogenic meningitis, polymorphs are seen. All right, all good to go. How about viral then? Viral ke andar kya hota hai? In the viral, there is normal glucose. That itself will tell me this is not bacterial. Okay. Viruses like enteroviruses, etc. There are many viruses who can cause meningitis. HSV, 2. That guy also causes meningitis. Molerate's meningitis, if you're aware of that. So here we go. The answer to this will be bacterial meningitis. Next, what is the best treatment of a patient having diarrhea with a flask-shaped ulcer? All right. So guys, you must understand that whenever this organism called Entamoeba histolytica, it invades our layers in the GIT, what will happen is it will form an ulcer that looks like a flask. Imagine this is a mucosal layer, and then this gentleman called Entamoeba came here, and what exactly it will do, it will try to invade from here like this. So from here it will start expanding like this in the side direction, and it roughly gives a direction or this appearance what we call as flask shape. And this obviously will be eventually filled with pus, what we call as anchovy sauce. Anchovies are fishes, right? So there is a sauce that we use to store that fishes, anchovy sauce. So it's dark in color, so the pus looks like that, anchovy sauce. And for Entamoeba who causes this bloody diarrhea, dysentery, the drug that we give in the treatment is metronidazole. Okay, although there is one more drug called paromomycin that also can be used, but the drug of choice is metronidazole. And somewhere or the other, if you have heard me before, you might have heard a mnemonic, go get on metro, right? Metronidazole uses go get on metro. What is that? Go for Gardnerella, G for Giardia, Entamoeba, Trichomonas. For all of this, we use a drug called metronidazole. Next question, a patient presented with multiple painful lesions over genitalia after having sex with a commercial sex worker. Which of the following is the most likely cause? All right. So, dear friends, first of all, like each word here will be important for diagnosing this. I've always told you there has to be one MCQ on the STDs, right? And I always said how to approach this kind of question. First, see whether they're mentioning lesion or discharge. They mention lesion. See, if they mention lesion, that means those STDs that present with discharge are already ruled out. Who are the guys who presents with a discharge? Trichomonas, chlamydia, gonorrhea. They cannot be the answer. Why? Because they mention lesion tha. Now, once you know there is a lesion, what you should do next is you should see, is this painful or painless? As long as they mention painful, you have only two options that can be painful. One is the herpes genitalis, and the second one would be Haemophilus ducreyi that causes a disease called chancroid. And this is the mnemonic I usually teach. If you remember, chancroid has a D. D for ducreyi you got to remember, and pronounce this word like this: patients do cry. Why do the patients cry? Because it is painful. ठीक है, तो multiple painful lesions में यही दो options हो सकते थे, but multiple lesions, recurrent lesions are usually seen with herpes. And anyway, chancroid, I don't know if this was in the option or not. अगर रहता तो फिर it would have been a bit difficult to answer. Herpes is the correct answer according to the current options. See, अगर दोनों option में दिया था, that means they should describe, lymph node involvement also. Then depending on the lymph node involvement, once again, we can come to the conclusions. All right. So that's it. This, according to the current situation, this is my answer, guys. All right. Chancre is painless. Chancroid is painful. All right. Chancre is seen in syphilis. All right. Next, quadranucleate cyst is seen in. Doctor, quadranucleate cyst is a feature of two parasites. One is Entamoeba histolytica and the second one is Giardia. Both of them has a cyst that will be presenting like this. It will have 4 nuclei inside it. This is called quadranucleate cyst. Quadra is 4. If you look at some other guys who also cause diarrhea in parasitology, they also have cyst. Example, Cryptosporidium. What is special with Cryptosporidium cyst is this organism produces a cyst which is pink in color, and that pink color is due to its acid fastness. It will be staining with something called acid fast stain, Cryptosporidium. It causes diarrhea in HIV patients. All right. Next, anyway, question asks quadranucleate cyst. So I'm going to talk about Entamoeba. That is the correct answer. Next one, an immunocompromised patient presented to the hospital. A viral infection was suspected. Microscopic examination from the sample collected shows owl's eye appearance. Identify the organism. See, probably the image was given or not given. Either ways, I believe in the middle of the night also, if I wake you up and ask you owl's eye, you will open your eyes like an owl and say CMV. Okay. So this is the correct answer. No second thoughts about this. CMV. This is the guy that shows the owl's eye inclusion bodies. Some people may make the mistake in the pressure of the examination. They may choose EBV. Why? Because in EBV, they study that EBV is associated with one cancer called Hodgkin's lymphoma. And this cancer produces one appearance due to a cell called RS cell, Reed-Sternberg cell. Okay? It's the cancer producing that, and the RS cell also has a roughly owl's eye appearance. So what people do, they skip the middle part, like it's seen in the cancer, not due to the virus directly. EBV doesn't do that. EBV is associated with one cancer and the cancer is having that appearance, RS cell. RS cell is used to distinguish between the Hodgkin's lymphoma and the non-Hodgkin's lymphoma. It is positive with Hodgkin's. Which of the following is the best diagnostic test for the monkeypox? Something new. See, one thing I have always told during my classes, agar best pucha chahe to always close your eyes and say PCR in the virology. Always, the best test is going to be PCR. HIV. What is the best test? PCR. All right. So remember this, anytime they are asking this, PCR is the best test. One more concept I'll give you right here. If they ask you early detection of something, okay, let's say within 1 week. If they say early diagnosis within 1 week, then you should go with antigen detection. Antigen detection. What is antigen? Antigen is a part of the organism, the enemy. When an infection organism enter inside our body, those body parts of the organism are called antigen. So obviously when you are having the disease, the first thing to be detected is antigen only, na? And after some time, at least after a week, your body will start producing antibody. Antibody ka detection will be at least 1 week later. So this is something you got to know, right? They may ask you the concepts based on this logic. So anyway, PCR would be the correct answer. A patient presented with vesicles on the lips. Sample was collected and the Zank smear shows multinucleated giant cells. What is the most likely organism? Doctor Saab, you got to remember that Zank smear word agar aaya hai, so this is done for HSV1 and 2, and it is also for HHV3, which is known as varicella zoster virus. This is the guy that causes chickenpox and shingles. All right. So you must keep in mind these three only we are going to have that. But since they mentioned vesicles on lips, see, one characteristic of herpes usually is vesicles, fluid-filled vesicles. Lips pe, they're talking about one infection called herpes labialis. Herpes labialis. Herpes labialis is something that is caused by HSV1. And how did I ask you to remember this? Number 1 means always on top. Yes or no? So yaad rakhega, number 1 is always on top. It causes lesions on the top of the body, that is in and around the face. All right. HSV2 causes lesions below, that means near the sexual area. HSV2 is causing genital herpes mostly. All right. So that's it. I would go with the answer herpes if it was mentioned. I don't know HSV1 was mentioned, how the question was asked, but either ways, this has to be answered from these three. All right, guys. Next, this I'm not sure. Some people said there was another question that was from fungi that was on histoplasma. Okay. So please let me know in the comments if there was any question, then I'll try to give you the answer, whatever it may be. Okay. So histoplasma mein, there is nothing much they can ask you. First of all, you got to remember that, see, this histoplasma, it affects something called reticuloendothelial system, that is macrophages. Okay. So this guy will be seen as a narrow-based budding, you know, inside those macrophages, intracellular organism. And one more thing you can say is this histoplasma is also called as cave's disease because it is going to spread through bats droppings. Okay, bats droppings. That's it.